struggling with irregular periods, acne, or sudden weight gain, it might not just stress. It could be PCOD, and all it starts with your hormones. Let's understand what's really happening inside your body. Hey there! Welcome back to the channel. Today, we're going to dive into a topic that affects millions of women worldwide, but is still widely misunderstood. Polycystic ovary syndrome. Whether you've been diagnosed with it, suspect you might have it, or just want to learn more, you're in the right place. So let's break it down and make it easy to understand. PCOD, or polycystic ovary syndrome, is a hormonal disorder that affects women of reproductive age. Thus, it impacts the balance of hormones, such as luteinizing hormone, follicular stimulating hormone, estrogen and progesterone hormones, which actually regulate the female reproductive and overall physiological health. Let's know further why and how it happens. Every woman has two ovaries, right? They're responsible for releasing eggs, which are essential for reproduction. Now, in PCOD, the ovaries can develop tiny cysts, small fluid-filled sacs. These cysts, however, aren't harmful. The main issue here is that the hormonal balance in the body is disrupted. In a normal cycle, the ovaries release an egg each month. But in PCOD, the ovaries don't release eggs properly. Instead, they often remain trapped in those cysts. This is what makes the process irregular, causing problems like missed periods, difficulty getting pregnant, or even excessive hair growth. So what causes PCOD? Well, researchers aren't exactly sure, but it's believed to be a mix of genetics and environmental factors. Some women are genetically predisposed to it, while factors like obesity and insulin resistance can also play a role. Many women with PCOD have higher levels of insulin. Insulin is a hormone that helps regulate blood sugar. When the body becomes resistant to insulin, it can lead to increased insulin levels in the bloodstream. This can cause the ovaries to produce more male hormones, like testosterone, leading to some of the symptoms we'll talk about in a bit. Let's talk about the symptoms. Now, PCOD can show up differently in each woman. But here are some of the most common signs you might notice. The irregular periods. Women with PCOD often have longer cycles or even miss periods altogether. This happens because ovulation doesn't happen regularly. Excessive hair growth in unusual sites called hirsutism. Acne related to hormonal imbalances. Thinning of hair, especially of scalp. Weight gain. People also struggle to lose weight, which can be linked to insulin resistance and prone to develop diabetes in later life. Infertility or difficult to conceive due to lack of ovulation or egg release. Now, how do doctors actually diagnose PCOD? It's usually based on three things: your medical history, physical exams, and tests like blood work or ultrasound. A blood test will check your hormone levels like estrogen, FSH, and LH. In PCOD serum, LH is often high. LH and FSH ratio more than 2.1 is classic, but not always present finding. Follicular stimulating hormone, or FSH, stays normal or slightly low, which leads to anovulation and irregular periods. Ultrasound helps doctors look at the ovaries to see if there are cysts present and developing follicles in the ovaries. Based on this, a doctor can confirm if you have PCOD. Moreover, increased insulin due to insulin resistance is common even in non-obese women. High insulin level stimulate ovaries to secrete more male hormones called androgen, worsening the symptoms of hirsutism or excessive hair. Due to lack of ovulation or egg release, progesterone levels do not rise, causing irregular periods and infertility. Hey buddy, till now learned something? If you found this helpful, please like and subscribe, as this will help the video to reach other people. What should you do to manage PCOD? 1. Lifestyle changes. This is primary requirement, as weight gain, fat deposition, and hormonal changes are interlinked. Maintaining a healthy weight through diet and exercise can help manage insulin levels, and reduce some symptoms. Vitamin D and omega-3 supplements are commonly used in PCOD support. 2. Medication. For irregular periods or acne, doctor may prescribe you hormonal medications like ethinyl estradiol, levonorgestrel, progesterone, only pills, etc. to regulate hormone, to treat insulin resistance, or to aid weight loss. Metformin may be prescribed by your doctor, which also help in ovulation. Sometimes myo-inositol supplements are used as alternatives or adjuncts. Please do not self-medicate any of these, as dosage and duration should be correct for their effectiveness. Otherwise, there can be adverse effects. Hair removal treatments like laser, anti-androgen hormone medications like spironolactone, finasteride, flutamide in severe cases of acne and excess hair after evaluating all kinds of pros and cons by the doctor. Fertility treatments. If pregnancy is difficult, medications like letrozole, clomiphene, gonadotropins may help to induce ovulation, thus prescribed for more advanced fertility management. The treatment of PCOD is highly individualized. If you think you have PCOD or you've been diagnosed with it, always talk to your doctor about the best treatment plan for you. Everyone's experience with PCOD is different, and it's important to tailor your approach to your own needs. Now, while PCOD is a manageable condition, it can increase the risk for other health problems like type 2 diabetes, heart disease, or endometrial cancer. This is why managing it is so important. A healthy lifestyle, regular checkups, and working closely with your healthcare provider can help prevent these risks. What should you avoid if diagnosed with PCOD? 1. Skipping meals or crash dieting. Unhealthy diet restriction to lose weight messes with insulin level and may aggravate the symptoms. Aim of balanced regular meals combined with exercise to support hormonal balance. Smoking. Smoking can increase male hormone called androgen, resulting in more acne and hair growth in unusual sites. It also makes the treatments ineffective. High sugar, high carbohydrate foods. Avoid sugary drinks, white bread, pastries, and processed foods. These spike insulin, which worsens PCOD symptoms. Being sedentary or lazy. Lack of exercise increases insulin resistance and weight gain. Even light, regular activity helps regulate periods and mood. Excessive caffeine or energy drinks can worsen anxiety and sleep, which affects hormones. Poor sleep and high stress raise cortisol, worsening hormonal imbalance. Aim for 78 hours of sound sleep and try relaxation techniques. Self-medicating hormonal or other medicines can mask your symptoms or cause more harm. Please don't do this without expert guidance, whether to regularize periods or cure acne or to lose weight. Okay, so that's a quick overview of PCOD. I hope you found this video helpful. If you or someone you know is dealing with PCOD, remember, you're not alone and it's manageable with the right support. If you have any questions or want to learn more, drop them in the comments below and don't forget to like, share, and subscribe for more health tips.